All right, it's Dr. Buford. Just getting started on your left shoulder. We're looking in from the back to the front. Everything you see is magnified 30 or 40 times on the screen. This is your biceps tendon on the right side of that cannula. As you look down at the biceps anchor, this is where we've been very suspicious that your symptoms are coming from. You can see how that pulls away a little bit. Sometimes that's normal in people. What's interesting is you've got some fraying there and evidence of an attempt to heal. And we know that you had chronic biceps tendonitis that we've been trying to deal with for quite some time. So I think we're going to do something with that. Your rotator cuff looks great. So here's rotator cuff. This is the undersurface of the supraspinatus tendon. Above that clear cannula, that looks fine. You do have a labral tear, and as we look back here, you can see the labral tear there. Okay? And so we're going to take a shaver and see if we can get that from anteriorly. If not, we'll put the shaver in the back. This is not the kind of labral tear that can be repaired, and it's not detached, it's just torn. So, give me a little slack on this shaver, please. So as we look here, you can see how it's torn. You can see also how thin and small the labrum is. There's no real way to put a needle in it to inject anything, and even if you did, it wouldn't heal because this piece of tissue is very small and clearly has no vascularity. So it looks like I'm going to have to finish that up from the back, which is what we'll get ready to do in just a minute. Before we do that, we're going to release the biceps so we can reattach it a little bit later. Pause. Let me show you as we release the biceps here. And then we're going to fix that through a very small incision in your armpit. Okay? So now we don't have to worry about that biceps after all this time. So we're going to switch the camera to the front by taking a switching stick. And then in just a minute, we're going to put the camera in the front. Okay, now we're looking from the from the front to the back. This probe, pause please. We're looking from the front to the back. What I wanted to show you is that this probe is only 2 millimeters from the bend in the probe to the tip. So we can measure, here you can see this labrum is 2 millimeters wide, okay? And as we look here, this tear is basically a split, but as it lifts up, it's maybe 2 to 4 millimeters of a tear. But you can see how that could potentially get caught in the joint and bother you. Again, no way to really heal that or put a stitch in that little piece of tissue that's 2 to 3 millimeters big, not even that thick. So we're going to debride it, and that works just fine most of the time. But I just wanted to show you how small this labrum is and how narrow it is, okay? It's basically the size of a hypodermic needle, the width of a hypodermic needle. So we're going to put in our shaver. Turn my pressure back down. And with our shaver, we just turn it on. It has suction attached to it. And as we pull back on the cannula a little bit, you can see how very quickly, pause please, just going to turn on the shaver here. With a little bit of suction, you can debride the labrum here. Okay. Lift up on the shoulder, please. Now, the other thing, hold the shaver, please. The other thing I should mention is we did examine your shoulder for instability, and you had no instability under anesthesia. So that was encouraging. But you see you've got this labral tearing all the way around. So it's interesting to note that even with this labral tearing, you had no instability in the shoulder. We've debrided the labrum. It looks a lot smoother all the way around. Okay, so we've taken off some bone off the anterior acromion. That's called a decompression. We're just checking here to make sure that we've gotten all the way to the anterior and lateral edge of the bone. The camera's coming in from lateral, and this instrument you see is coming in from the back of your shoulder. You can also see we've released the coracoacromial ligament. Okay, so there's a little bit of a lip here, right there, that I'm going to remove. We'll show you some more in a minute. We're done with the decompression. We're going to look down at the rotator cuff to make sure that there's no surprises on this side. Move the cannula. And as we rotate, that actually looks pretty good. No signs of any problems with the rotator cuff. So this will be, hold the camera, this will be the end of the video, because everything else that we need to do is going to be through a 1.5-inch incision in your armpit, and we can't show that on video. So we're going to finish up here and get you back to the recovery room in probably about another 20 minutes or so, okay? So I really hope this does the trick for you. Good luck to you now. Bye-bye.